Hi, my name is Susan Disser, and I'm a Family Practice Nurse Practitioner. I decided that if I could be a nurse coupled with being a lactation consultant, I could help mothers and babies and families better. So that's what I did, and then I decided that through the experiences I've had throughout my life, I could better serve people in the community by becoming a nurse practitioner, and that's kind of where I am. It's kind of like all the things that occurred in my life brought me to this point, and I feel like it's all the trials and tribulations and everything that I've been through brings me right to where I need to be, which is right here. So I think that nurses in general, we are trained to be good listeners. We've done that throughout our whole careers. As a lactation consultant, I take that one step further because most of helping mothers and babies is meeting them where they are, listening to their concerns, and trying to help them through difficulties. So I'm happy that I'm a nurse practitioner in the sense that I have time to spend with my patients and really get to know them. And through the listening, they feel safe to share their experiences with me. And that makes for a really good process and really good care. So I think that accessibility, my patients have, my portal is set up different than most people's. They can send messages directly to me if they need refills, if they have a question, and I encourage them to do that. So I look at my messages on the weekends, on my days off, usually within 12 hours, never more than 24. And I want our decisions to be a joint decision. So when we do need to make a decision, I want to bring them into the loop, and I want to make sure that that is what they want and not just what I want for them. My children live out of state. My family's all out of state, so I really work and school are my passion, so I put most of my energy into that. I do travel and visit my sisters and my children, but usually I'm in school studying. Number one, I spend time with my patients. Number two, I try to incorporate how I would want my family members treated, and things that during my children growing up kind of bothered me. So things that I make sure that I do is when patients have questions, I make sure that I get back to them quickly by giving them that access directly to me through the portal. My sick patients, I make sure that I get them in the same day because it doesn't make much sense to have a primary care provider if you're always going to an urgent care. I just try to treat them the way that I feel like people should be treated.